Do you know Christine? As executive director of a community health center, Christine takes the vision and mission of her organization very seriously. She is responsible for overseeing the organization's activities, as well as its human and financial resources. As a certified member of the Canadian College of Health Leaders, she is committed to meeting standards of excellence and seeks recognition for her team. Christine faces some challenges. She wants to provide equitable and safe health services at all times, and also wants to make sure her organization is inclusive and recognized accordingly. Her community health center operates in an environment where the demand for services delivered in French is growing. She also has her share of issues. These include difficulty recruiting and retaining staff, as well as juggling limited budgets and multiple priorities. Furthermore, she lacks knowledge and doesn't have much time to research proven strategies and tools to address her challenges. Where could Christine turn for help? Christine heard about the partnership between the Foyer Richelieu and Hospice Niagara to build a new palliative care unit in Welland. She saw the announcement about the new Center of Excellence in Palliative Care for Francophones, which is set to open in 2024. What an inspiring initiative! She did some digging to find out how Hospice Niagara went about the project. She discovered that managers developed, implemented, and monitored their French language services plan using EquityLink. EquityLink is designed to support healthcare managers in the planning, implementation, and evaluation of French language services in their health, social services, or community organizations. Christine will discover resources, a path forward, coaching, and a community. EquityLink offers 7 resources accredited by the Canadian College of Health Leaders: Equity Fundamentals, the Café de Paris Approach, Logic Model Guide, Policy Guide to support French language services, Bilingual Health Workforce Strategy 2.0, Communities of Practice, a collaborative approach to increasing French language services, and a showcase on the active offer of French language health services. EquityLink is an A to Z guide that includes strategies, action monitoring, and training for successful and sustainable implementation of French language health services. It includes a self-assessment of current capacities, a dashboard for consulting reference data, help to prioritize courses of action as appropriate to the context, and a real-time approach to progress monitoring to facilitate accountability. By following the understand, plan, implement, and evaluate steps, Christine works at her own pace to reach her personalized objectives. She benefits from the expertise of 25 specialists from across the country with training in capacity building and coaching. These experts use individualized follow ups to point managers and their teams to the right resources for them. They help prioritize what actions to take based on the local community needs and help leverage local resources to support their effort. Christine is not alone. Her team is involved in the process and supports her every step of the way. In addition, 250 managers, just like her, have already found support and resources on EquityLink. She has access to regional learning community, which introduces her to the different players in her field and allows her to form relationships that will support her through the process. Well done, Christine. The organization is making all kinds of progress, and the conditions for continued improvement are in place. The manager is now confident that the center she runs is properly set up to offer bilingual services. She involves her organization in Accreditations Canada Official Languages Recognition Program to have her team's effort recognized. She earns credits from the Canadian College of Health Leaders to maintain her certification and obtain the health leadership specialty and equal access to French language health services in a minority setting. The entire community benefits from her efforts. Thanks to improved organization of human resources, active offer of French health services, organizational leadership, and more, Christine's Community Health Center is now able to serve the Francophone population in French. And by changing her approach in a fundamental way, the manager has successfully boosted her community engagement and is now able to apply her learning to other minority language communities. Do you recognize Christine? She's one of a kind, just like you. Hundreds of health managers across Canada have the same challenges, issues, and aspirations as Christine. And EquityLink is there for each and every one of them.